Hi, this is Dr. David W. Kim. Tonight's video blog on rhinoplasty is about how to make the perfect nasal profile. Well, first of all, there is no one perfect profile. Just like in the rest of the nose, the goal is to create smooth contours. And whether or not the profile ends up being straight, slightly curved inward, or slightly curved outward is less important than the nose being overall having the correct smooth contour. This is because that patients don't always want the same thing. Now, it's pretty obvious when someone comes in with a deformity like this. This woman was in a traumatic injury, she had a severe collapse of her nose, and her goal was to get her nose straight. So I used a piece of cartilage from her rib to form a graft that created a smooth contour. It created and restored the normal line that was on her bridge, and it also fixed the depression that caused this harsh shadow in the middle of her nose on the front view. However, in reality, a nice outcome varies depending on the patient's anatomy and their goals. Sometimes we create a contour that has a slight inward curve or concavity. Sometimes we create a straight bridge. Sometimes we create a very slight outward curve or convexity, and sometimes the patient wants to preserve a very large convexity. Now, all of these patients were happy patients, and these are all postoperative photos. There's lots of ways to go. Traditionally, when we think of rhinoplasty, patients think that, oh, I have a bump. Why not just remove it? Cut it off. And that's exactly what we did in this individual. Now, in order for this to work, the skin has to be able to contract. If you think about it, when we remove a big bump like this, we're making the nose smaller internally, and then you have too much skin. So the skin then has to shrink, like a shrink wrap effect, in order to conform to the structure that you've created so that the improvements can be transmitted through that skin envelope. In some situations, it requires a combination of treatments, like in this gal. We did a reduction of the bump on the bridge, but we actually elevated and projected the tip. So there was more a redistribution of volume rather than an across-the-board reduction of volume. It worked for her because her tip hung low and it had a hooked appearance. So by bringing the tip up and reducing the bridge, we were able to give her what she wanted and a more balanced appearance to her face and her nose. In this individual, his tip hung way down. It pointed down, it was angled down, it came down further when he smiled. So we did very little to the bridge except to shave it off maybe less than a millimeter. And the majority of the surgery to create the better profile was by elevating his tip. This is another patient where we did a combination of treatments. We reduced the bump on the bridge, we brought the tip forward and up, we also reduced and lowered her arched nostril. All of this created a better profile. Now, this is me. I have not had any cosmetic surgery to my nose. I do have a somewhat convex or outwardly curved nose. If I had very thin skin, it may be possible just to remove all of the structure that creates the bump or the high point and create this type of result. So again, this would be before and this would be after, assuming that my skin was thin enough to contract to that distance. Now, if someone has a nose like mine with very thick skin, and we're afraid that the skin cannot shrink to conform to that lowered structure, instead of reducing the bump, we can add structure above it and bring the tip forward, like you see in this picture. So again, this would be the before, and this would be the after. Now, when we put the when we put the after picture of the reduction and the after picture of the augmentation, in both situations, the nose looks better than it did before. The nose looks like it has triangularity, the nose looks like it has smooth contours, and in both situations an improvement is gained. This reminds us that we don't have to necessarily just take one type of approach. It depends on the anatomy, the limitations of the skin envelope, and most importantly, the preferences of the patient. So in summary, profile-plasty or making the side view of the nose better is one of the most common reasons patients seek rhinoplasty. The approach depends on the anatomy, the limitations of the skin envelope, and the preferences of the patient.